So, good morning. My name is Ashley Craiglow. My pronouns are she, her. For a physical description, I'm a female with shoulder length dark red hair and glasses, and today I'm wearing a dark green shirt. I am joined today by my colleagues Gina Marsala and Georgia Lane with the Arrowhead Area Agency on Aging. And we'd like to welcome and thank you for joining us for today's session on funding opportunities for those serving older adults in Northeastern Minnesota. So before we start, just a few housekeeping items. We are excited to announce that today's webinar will be accessible to a wider audience. We have arranged for American Sign Language interpreters who will be present throughout the session. These interpreters will rotate about every 20 minutes, ensuring that everyone can follow along with the content effectively. If you need the interpretation feature, you just want to go to the bottom of your screen and click on the interpretation button, and they should pop up in a screen for you. Additionally, the webinar is being recorded with the ASL interpretation, and these recordings will be available on the YouTube channel for later viewing. Whether you attend the live session or catch up later, you'll have the opportunity to engage with the material in a way that suits your needs. We encourage you to subscribe to our YouTube channels so you can keep up with the latest addition to our video library. And we're always looking for suggestions for future webinar topics. So if you have suggestions for topics or speakers, feel free to send those to me in an email, and I'll share my email in the chat with you. If you can, please keep your microphone set to mute, and just note that if you're experiencing any issues with bandwidth or audio quality, it often helps to disable your camera. So if you'd like, you can enter your first name and organization and community that you're from into the chat box. I know a lot of you already, but feel free to put those in there. And then what you're hoping to get out of today's session, or how you found out about our webinar. If you have any questions during today's session, please feel free to put your question into the chat, and we will address those at the end of the presentation. And we will also take some time for additional questions at that time as well. And then at the close of today's session, you'll receive a quick evaluation pop up in your browser. So if you could please take a moment to complete that survey, it helps us greatly when planning future sessions. And then one last quick reminder is to visit our Facebook page for more information about other upcoming sessions, such as our volunteer opportunities in the Arrowhead, which is being held on Wednesday, July 16th. You can also check out our website at arrowheadaging.org. All right, so a little bit about the Arrowhead Area Agency on Aging. The Arrowhead Regional Development Commission is designated by the Minnesota Board on Aging as the Area Agency on Aging for planning and service area under the Title 3 of the Older Americans Act. The Arrowhead Area Agency on Aging is committed to helping older adults maintain their highest level of independence. Area agencies on aging are regional organizations that provide services, supports, and information for just about everything that older adults and their families could need. Minnesota has 7 AAAs across the state that are local connections to older Minnesotans and the community supports they need as they age. The Arrowhead Area Agency on Aging Planning and Service Area, as designated by the Minnesota Board on Aging, includes the counties Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis. So now I'm just going to take a moment to read our Arrowhead Area Agency on Aging land acknowledgement. So as we support our mission to help older adults maintain their highest level of independence, we do this while being respectful of the space we are being welcomed into by Indigenous people. We strive to deepen our understanding of the multiple ways in which people see and understand land and acknowledge the Indigenous people who have relationships in this land. We also know the decades of historical trauma, loss, and grief experienced by Indigenous people. It is our promise to not only recognize these truths, but to also take action to show support of our Indigenous elders, neighbors, and friends, and understand our place within the past, present, and future of this land. We know this is just one step in recognizing and honoring the sovereignty of tribal nations. All right, so I'm going to now turn things over to Gina.
Hi, everyone. I see a lot of familiar faces, but I'm Gina Marsala, and I am our Older Americans Act Grants Manager here at the Quad A. Um, and you can go to the next slide. So just a little bit about the Older Americans Act. I'll start with the history. So in 1965, Congress passed the Older Americans Act in response to concerns by policymakers about the lack of community social services for older adults. And the act authorized grants for communities, and it could be used for research for projects and then personal training in the field of aging. And it was part of ACL, but currently the Older Americans Act is now part of the Department of HHS. And so that is one thing that has currently changed. And some other changes that are happening for the Older Americans Act. I believe it was last year, 2 years ago, they started the final rule. So they are changing some of the rules just to get updated with the way times are now. And so us as a agency on aging, we have to be in compliance with the new final rule in 2028. So you'll probably see some new things coming down the pike these next few years. Next slide, please. All right, so the Aging Network, this is the structure of how the Older Americans Act is. So it starts at the federal level. So these are federal funds, and then they are passed down to all 50 states. And then those states disperse the funds to the area agencies on aging. And there are a whopping 622 area agencies on aging throughout the United States. And then once the funds come to us, we grant them out to our local service providers. All right, next slide, please. Right, and then with the Older Americans Act, there are many different titles, and the one that we closely work with is Title III, and so those are grants for our communities. And as you can see, some other ones that may be familiar to you, Title VI, those go to the tribes around the area. And then Title IV, I believe that is like our ombudsman's office. So you'll see that they touch us in different ways. We might just not work directly with them. All right, next slide, please. All right, so our Title III Older Americans Act funds, those they help our older adults live in our homes and communities as long as possible, as long as they want to. The way that I look at Title III funding and explain it to folks is that the Title III funding really hits those folks that are kind of in the middle. So there are those folks that are on waivered services, and then there are those folks that have the ability to private pay. But there are the group of people that are right in the middle who don't quite make enough to private pay for services, but make too much to be on waivered services. So Title III funds really help those people that are stuck kind of in that middle. So yeah, next slide. Oh, perfect. Just keep going through these. So our Title III funds are broken into 4 different categories. So our Title IIIB services are for supportive services. Those are our legal education, legal assistance through legal aid, Justice North in our area. Homemaker, chore, assisted transportation, consultation, visiting, consumable supplies. There are more on the list, but these are the ones that are mainly used in our area and across the state. If anyone is interested in seeing the list, I can definitely send it out with the information that will be sent out after the meeting today. And then our Title III-C nutrition services. So this is our congregate meals and our home delivered meals. Most people know them as Meals on Wheels through AEOA. And then can you go back, please? Sorry, thanks. Our Title III-D, this is our disease prevention and health promotion program. So our falls prevention classes, our chronic disease self-management, diabetes self-management, SAIL, all those great classes. And then our 3E caregiver support. So our respite support, our support groups, supplemental services, powerful tools for caregivers. So these are our focuses. And like I said, there are more programs and services that are on the list, but these are our main ones that are covered in our area. All right, next slide, please. All right, and so people who are eligible for services, so they're a little different with our Title III, B, C, and D. So our supportive services, nutrition, and evidence-based health promotion programs. So anyone over 60 plus is able to receive services through Title III. But we do have a targeted population, and that is people 60 plus with the greatest economic need, social need, and emphasis on low income minority individuals, just low income, frail individuals, and older adults residing in rural areas. And then our caregiver support is a little bit different. So anyone eligible that is caregiving for a person that is 60 plus. So say a wife that is 55, but she's caregiving for her husband who is 60 plus. She is eligible, even though she's not 60, to receive caregiver services. And again, we do have a targeted population that we like to serve, and that is caregivers of frail individuals that are 60 plus and greatest economic need, low income minority population, and then caregivers of persons with Alzheimer's disease related dementia, regardless of age. Next slide, please. All right, so our funds are in a 3-year funding cycle. And so this year is our competitive round. As of 9:30 today, our applications are open. And so right now, applications are open, and then the new funding cycle will begin January 1 of 2026. And then 2027 will be a renewal year. So those folks that receive funding in 2026 will have the chance to reapply. And it's only those folks that or organizations that receive funding in 2026 can apply again for 27 and then 28. Sorry, that last slide, I guess, box didn't get updated to 2028 instead of 2025. And then every year we do have some carryover usually from the state, from the previous year that can be spent. And so sometimes we have special rounds for short-term projects. So if you are an organization that maybe kind of wants to dabble and get their feet wet in Title III and not do a full 3-year cycle, you can always reach out to me and let me know that you are interested in some funding, and we can see if we have some for carryover that we can grant you for a short term. Everything is the same, just it's a short term instead of the full 3-year cycle. All right, next slide, please. All right, and so our applications are, like I said, they are available right now on our Smart Simple platform. So what goes into our application? So we have cover sheet, budget, details, those are all together. We do have a narrative that we ask for. our cost share policies, those are in there. We ask for cost share scales, and then we do have some assurances that we also ask for as well. And if anybody who is interested in looking at our applications, I will also send link to that in the follow-up information. You just have to create a profile for your organization, and then you can have access to the applications and look through the RFPs. And yeah, and then I should, let me see, quick. We will be having like an informational session. Those are the date and the link to the meeting is listed at the bottom of our RFPs. I can now remember off the top. Oh, here we go. It will be July 15th at 11 a.m. is when we will have that information session. So basically, if you have any questions or are want to bounce some ideas off of our staff about projects that you may have in mind, that would be a great time to do that. And then next slide. The date, it will be Tuesday, July 15th at 11 a.m. And the link and date and time are at the listed on the bottom of the RFPs that are active on Smart Simple right now. And I will put the link to the Teams meeting in the chat too for you guys. And if you have any further questions about Title III funding, you can reach out to me. And I have my email listed, or you can call our office and get a hold of someone, and I'll get you connected to me as well. But thank you, and yeah, I'll look through the chat, see if there's any other questions and respond to you as well.
All right. Thanks, Gina, for presenting on that. I'm going to switch us over to some state grants now. So we are going to first talk about the Live Well at Home grant. So projects for this grant are intended to develop and or provide services for older Minnesotans to live and age in the community of their choice, improve their community's capacity to develop, strengthen, integrate, and maintain home and community-based services for individuals aged 65 and older who are at risk for long-term nursing facility use and or spending down medical assistance. And then strengthen services for supporting older solo agers, families, friends, and neighbors who are caregiving. And so again, the link for this grant will be on the slides that we will send out next week. So projects for this grant are split into 3 categories. Category 1 is capital and renovation request projects, and this can include new construction, renovation, retrofitting, home modifications, transportation, like the purchase of an accessible vehicle, and then technology. Capital and renovation grants are available for new build renovations, retrofitting, modifications to enhance accessibility in homes or buildings. These efforts should foster innovative housing and service solutions, create affordable units suitable for home care, and cater to those aged 65 and older and over with chronic health conditions. Retrofitting aims to lower healthcare costs by adapting homes for aging in place, especially those lacking essential features. And then category 2 is long-term services and support development grants. So this can include support such as chore service, homemaker, supporting family, friends, and neighbors and caregiving, respite, transportation, and chronic disease management. And then category 3 is the core home and community-based services. So core home and community-based services aim to strengthen and develop additional home and community-based services and alternatives to nursing homes and other residential services throughout Minnesota to allow older adults, regardless of income, to remain in their homes for as long as possible. Core home and community-based services complement community services by covering some fixed cost for small nonprofit providers offering community services and additional services such as transportation, home modification, chore, or companionship. Organizations funded under core home and community-based services typically have operating budgets of $175,000 or less annually and serve geographically limited areas. So we are just going to look at some of the organizations that were awarded Live Well at Home grants in 2025, and some of you are on this call, which is great. So first we have Churches United in Ministry, or CHUM, in Duluth. The goal of their project is to help older adults with histories of homelessness to age in place. The project seeks to increase resident participation in professional services that support health, healing, and stability, including medical, mental health, and recovery. Other objectives are reducing the number of residents who return to homelessness by keeping them involved with a community stabilized by safety, services, and on-site staffing. Next, we have Elder Circle in Grand Rapids. Using an innovative approach with community health workers, the project will enhance and streamline community-based services for informal caregivers like family members. Services will help veterans, solo agers, and others age 65 and older, with an emphasis on underserved and culturally and racially diverse people living in rural areas. Next, we have the Lighthouse Center for Vital Living in Duluth. The Empowering Older Adults project will benefit 600 older adults and 250 caregivers in multiple Minnesota Arrowhead counties by promoting older adult safety, self-reliance, and quality of life. Services will include in-home occupational therapy, assistive technology, device loans, technology training, activities to combat social isolation, caregiver support, and home modifications. And then we have North Shore area partners in Silver Bay. Funding will provide in-home services and supports to 35 older adults living independently in their homes. Volunteer recruiting will increase. New programming will promote the health and well-being of older adults by coordinating with community partners to offer health, nutrition, and safety topics, financial fitness planning, and aging solo programming. And then last, we have Volunteer Services of Carleton County. Funds will strengthen service capacity in assisted transportation, group respite, caregiver counseling, and chore services. Delivery of services to at-risk families, Native Americans, veterans, LGBTQ+, and low-income older adults will be a focus. All right, so next we're going to look at the dementia grants. So these grants are intended to increase awareness of Alzheimer's disease and other dementias, promote the benefits of screening for early identification of dementias, increase the rate of cognitive testing in the population at risk for dementias, and/or connect family, friends, and neighbors who are caregiving to education, support, and resources. So in the region, the following organizations were awarded grants. First, we have Age Well Arrowhead in Duluth. Funding will support the hiring of 10 or more REST certified respite care providers to increase the availability of in-home respite for dementia caregivers in the greater Duluth area. And then next we have Community Partners Living at Home program. This project will offer dementia education and awareness programming for the community and provide family and friends, caregivers of persons with engagement and actions to reduce isolation. And then next we have Health Equity Northland in Duluth with a focus on African American and African heritage community, health equity, dementia, community awareness and education, adopt or create culturally relevant screening tools, conduct in-home wellness visits, and pilot strategies for culturally relevant active programs for people in Duluth care facilities. And then have Koochiching aging options in International Falls, serving all of Koochiching County. Grant funds will support continuing dementia-friendly initiative, offering one-to-one support and resource navigation for dementia caregivers, and increase the Connect Cafe and Memory Cafe attendance. And then we have Lighthouse Center for Vital Living in Duluth. This project will leverage expertise in adaptive technologies and occupational therapies to connect family and friend caregivers with assistive technology, caregiver resources, and cognitive screening. And then last, Volunteer Services of Carleton County. Funding will support 2,500 hours of respite service through the Daybreak group respite in Carleton and St. Louis counties, and explore adding another group respite program for caregivers in Pine County. All right, so next we're going to talk about the provider capacity building grants and underserved communities. These grants are specifically designed for HCBS providers, and they're available to two types of organizations. So the first is new organizations that are looking to become HCBS providers for the first time. And the second group is for existing providers who want to expand their current services or increase the number of people they serve in their communities. So let's walk through what these grant funds can be used for. So the funding is quite flexible and can support several key areas. Program development and expansion. So this includes enrollment in medical assistance waiver programs, which is often a crucial first step for new providers. Developing entirely new HCBS service lines to meet community needs. Or expanding access to underserved populations or geographic regions that currently lack adequate services. Cultural responsiveness and accessibility. So this looks like expansion of culturally specific service delivery, recognizing that effective care must be tailored to different communities. And then translation interpretation services to break down language barriers and ensure equitable access. And then infrastructure and operations, so establishing billing systems specifically designed to bill medical assistance programs, supporting rural or regional centers located outside the 7-county metro area with resources where they're often more limited. And then priority populations. So this funding program recognizes that certain communities face additional barriers to accessing HCBS. So priority funding is available for organizations serving rural or regional communities outside the 7-county metropolitan area, American Indian and Indigenous communities, Asian and Pacific Islander populations, Black and African born communities, Latin communities, and then LGBTQ plus individuals. These priority areas reflect a commitment to addressing health equity and ensuring that all older adults and people with disabilities have access to services they need regardless of their background or where they live. So whether you're a new organization ready to enter the HCBS field or an existing provider looking to grow your impact, these grants offer valuable support for expanding access to essential community-based services. The funding recognizes both the operational needs of providers and the importance of culturally responsive, accessible care for all communities. So the organizations listed on the slide are recipients of the third round of HCBS provider capacity grants. This competitive funding awarded 8.9 million statewide for the grant period of December 2024 through June of 2026. The response was significant. Over 230 organizations applied for this round of funding. with 70 organizations ultimately receiving awards across Minnesota. These Northeastern region grantees will expand HCBS capacity to serve older adults and people with disabilities in rural and underserved communities throughout our region. All right, so the Minnesota Department of Health is offering Healthy Brain Community Grants to address Alzheimer's disease and related dementias in underserved communities. These 3-year grants provide up to $20,000 annually with a maximum of $60,000 per organization. The program specifically targets communities that face barriers to diagnosis and care, including BIPOC communities, LGBTQ plus individuals, American Indian populations, people with disabilities, and rural greater Minnesota communities. Funded projects must focus on one or more of the 3 key strategies, which include educating communities about dementia risk reduction, improving early detection and diagnosis, or providing support for caregivers and people living with dementia. A wide range of organizations can apply, including community-based organizations, nonprofits, faith-based organizations, healthcare organizations, and tribal governments. All right, and then last, I just have a slide with some additional funding options and resources for organizations that may be looking at expanding or starting transportation services. So I'm not going to take too much time going into them, but if you have questions, feel free to reach out to myself, or I can get you in contact with the Arrowhead Regional Transportation Coordinating Council as well. So I'm going to now turn things over to Georgia.
Thank you, Ashley. That's a lot of information and a lot of great stuff. So I'm actually going to pause before I dive into mine because I want to make sure we have enough time. There's a couple questions in here. Gina, the first 2 I think are for you. So Gina, if you're available, the one question was how much funding is available for title? And then the second question for Gina is, can you touch on the cycles again? Is it becoming every 3 years?
Yes, so for 2026, we currently don't know how much funding we have to grant out. The state is still working on getting those numbers to us. We are hoping to hear back sometime this month. And once we have the update RFPs in Smart Simple, and I'll probably send out a quick email. And then for the funding cycles, they have always been a 3-year cycle. So the first and then the next 2 are always the same grantees apply for the following 2 years. So we're just keeping on with the same 3-year cycle.
Right, and I actually have a follow-up question for that. Gina, do you think our Title III funding for this year will be comparable to what it was in past rounds? Or anticipation for any areas that might be cut based on federal changes or other changes?
I don't think anything will be cut federally, but I think it has been decreasing the past few years, just by little amounts. So I'm assuming that'll probably still be the same. I don't see any big cuts, just the same small amount that has been cut every year.
Yeah. Awesome. And then the next question Julie asked, will the Quad A be able to provide technical assistance to state grants? The answer is yes, absolutely. Through our EDP team and the rest of us. So we are always here to provide any kind of technical assistance. Again, we don't have like a magic wand with state funding. We just try to be extra eyes and ears and build those relationships with our state partners to make sure that we get the correct information, that you guys have the correct information. We want to be an ally to you guys in the work that you're doing. And I see Ashley already answered that. All right. So feel free to keep popping your questions and thoughts in the chat. You can go to your next slide. All right, so I just want to do a disclaimer. When I started to dive into this, we're in challenging times. We all know that. We know that there's, potential federal cuts and everybody's scrambling a little bit. But so we thought, let's just, some of these resources might be very well known to a lot of you. Some of them might be new. We've got folks from all different areas who are calling into this today. So this is not exhaustive by any means. And so as I'm going through this, if there are other grantors that you've worked with or other foundations and found other kind of creative funding sources, please feel free to share. We will have a little bit of time at the end to put it in the chat. But with all of your work, if you guys as community organizations have an idea, we do our best to try to keep our, ear to the ground for what's going on, or like if you're thinking, hey, we've got this really great idea that we'd like to fund, or we got X amount of funding for this project, but we need a little bit more. Come to us and we will do some digging and research for you. So that is well within our purview as providing technical assistance and development throughout the region. We want to leverage our networks. We have different contacts working on different projects throughout our region and throughout the state. So part of what we do, we're network weavers and builders. And so all of that to say that, this list that we're doing here is not exhaustive. I could have spent a lot more time on different foundations and funders. But this is just kind of a snapshot of different ones that we are familiar with and ones that we've worked with in the past. So our list, a handful here of regional community foundations. And also, I was going to put, and I'll find the link for this in the chat, but about a month ago, we did a webinar with the Minnesota Council of Foundations on talking about, even if you don't think you fund aging, if you're funding and investing in rural communities, you are funding aging just based on the demographics. That 1 in 3 people are over the age of 65 in rural communities. Many, 40 to 50% are 40 or are 50 and over. And so even if you think that you are, you have a project and I only do aging, I think we need to think more creatively about, there's only a small percentage of foundations. I think it's 2% of foundations in Minnesota fund aging, but we need to think differently, right? Let's think about our public spaces and think about social connection and intergenerational connections. So many of these that I have listed here aren't specifically noting that they fund aging services, but we know that, all roads lead to aging and there's so much intersectionality. So that's why there's kind of a broader list of foundations here. So just starting off, Arrowhead Regional Arts Council, you'll see here I have listed the funder, the geography, and then about. This is, our 7-county Arrowhead region, and this is serving individual artists, nonprofits, arts organizations, informal groups, community ed, and non-arts nonprofit organizations. The next one has a new name. It was formerly the Duluth Superior Area Community Foundation, now rebranded as Boreal Waters. They do 7-county Arrowhead plus Northwest Wisconsin. This is a really cool foundation that you dig into it, and there's a number of funding streams or foundations and pots of money that kind of go through this. So there's a lot to be funded under this. The next one is the Grand Rapids Area Community Foundation, which serves Itasca County. This is kind of a broad arching one that looks at community resources, that would significantly benefit the community for the resources invested. Anything that's creative, innovative, and addresses community needs, eliminates duplication of services, and increases volunteer involvement, as well as leveraging other resources. And then, of course, I'm pretty sure everybody here knows about the Northland Foundation, but I couldn't not list them. They fund basic needs, belonging, domestic and sexual violence prevention and intervention, early childhood care and education, out of school time, as well as aging on there as well. Next slide. All right, corporate foundations. Blue Cross Blue Shield Foundation, you can see here kind of that I've bolded some of the areas that relate to probably some of the work that we're doing throughout our aging network. So Blue Cross Blue Shield Foundation is statewide. They look at increasing access to health insurance coverage and increasing social connections within and across communities and generations to reduce social isolation. Next one is the Medica Foundation. This is kind of a timely one. They've got some rural health grants coming up. I believe that those open July 1st. Minnesota Power Foundation, serving central and northeastern Minnesota, supports effort to improve the health and vitality of communities, and grants and sponsorships are awarded to organizations that benefit residents, customers, and communities in areas served. So they're really a wide variety that can be projects and things that could be covered under that. Wells Fargo Foundation and US Bank Foundation, both are national. The Wells Fargo Foundation provides grants at the national and local level, which focuses on supporting organizations championing financial mobility, access to affordable housing, and supporting financial mobility. And then the US Bank has 3 categories: work, home, and play. And then last on there is the Lake Country Power. They're focused on community service, education and youth, community economic assistance, environment, emergency energy assistance, and disaster relief. Next slide. And if anybody has, if you've been working with a foundation or a funder in one of these areas, feel free to pop it in the chat as well. And then private foundations, the 4 that I called out on here, of course, the Blandon Foundation. They have had some shifting funding priorities over the last few years, I know, but it's always worth taking a look at. They're located in Itasca County, but I knew they do grant making statewide. They offer grants and leadership programs to strengthen communities and support economic development. Lloyd K. Johnson Foundation looks at Cook, Lake, and Southern St. Louis counties and Grand Portage. So that's kind of just up the shore, I guess. Looking at funding social welfare, arts and culture, education, community and economic development, as well as the environment. The Ordine Foundation is pretty much Duluth focused with the surrounding communities. Really basic needs there: food, shelter, clothing, healthcare, and personal safety, and strategies to break generational cycles of poverty. And then last on there is the Victory Fund, which serves Cook, Lake, St. Louis, Carlton, Itasca, Northern Pine, and Koochiching, focused on chronic health conditions, substance misuse, recovery, mental health, and dementia. Next slide. This is my last one. So here's a kind of additional funders. We have the AARP Community Challenge grants. Those come out every year, I think in February or March. They are kind of these quick action grants. There's a lot that can be covered under those. These are pretty competitive grants. They have their flagship grants, which support kind of public space work, building great public spaces, looking at another areas, transportation and mobility, housing, digital connections, and community resilience. The next for that is capacity building micro grants, which looks at disaster preparedness, walk and bike audits, home modifications. And then demonstration grants, which are pedestrian safety, high-speed internet, reconnecting communities divided by infrastructure, and then implementing housing design competitions. And then second one on there is the IRRB, which I'm sure most people are familiar with. We don't often think of it for aging services, but there are some areas there and projects, through our age-friendly community work and others that touch a lot of these areas. They have culture and tourism grants. This isn't extensive for what IRRB funds, but it's just kind of a couple that I pulled out. So projects that support arts, culture, history, tourism, and recreational activities. They do some work in workforce development. They also do grant writing assistance, which reimburses the costs of preparing and applying for non-agency grant that would advance economic growth. So if you could make a case there, just knowing that they are there as a resource to help with grant writing assistance. And then last on there is housing grants that will result in new housing units or the rehab of existing housing units. So I know there's a lot of work in our space around home modifications and work on that. So that's a good one to keep in mind. And then this one should actually gone on the corporate foundation, but I ran out of room on the slide, so I just plopped it on the end. Centerpoint Energy Foundation, which is statewide. They're looking at community vitality. Again, they've got a piece there in housing, the environment, conservation, as well as environmental education programs, and then thriving communities, where quality of place and resident-led initiatives leading to vibrant communities. So a lot of work on age-friendly community work could fall under there, or any kind of coalitions that you're working on in your community. So with that, we can maybe just open it up for questions. Next slide. Next slide, please. There we go. Thank you. So this, we can just pop it open for questions. And when we send out our things, I was able to actually, it wasn't on this slide deck, but I do have the links to all those foundations that are on there. So you can have that link directly. And like I said, feel free to reach out to any of us at the Quad A if you want to brainstorm or have us dig deeper on any of these ones that we listed or others. So we can pop it. If anybody has any questions, feel free to unmute or any resources they'd like to share. You can also pop it in the chat.
Georgia, this is Renee Bymerk. I am
Hi.
curious if, do you know the dates for the capacity grants?
Through the HCBS
Yeah,
capacity
the gear
grants?
ones. Yeah.
I don't, Ashley, do you?
I don't know it off the top of my head, but I can look it up and then I'll send it out in the follow-up email. And that should go out next week after I get it uploaded to YouTube so that you guys
Okay.
can go to the recording, but I don't know it off the top of my head.
To me, it seems like the times have changed each time, but I know it's a kind of a newer thing. So maybe they're just getting there into their rhythm. So I appreciate it, Ashley. Thank you.
Yeah.
Yeah, I would agree that with that gear division being newer in the HCBS grants, I think that it's felt like it's been a bit in flux. I think they're a great one to keep our eye on, but I think that they're trying to figure out where they fit with all the other funding that comes out of DHS and MDH. Any other questions? All right, well, with that, I'll hand it back to Ashley.
Yes. So I will just quickly say that we have two really great webinars coming up again this summer. We've got volunteer opportunities in the Arrowhead coming up on July 16th, and as well as accessing food resources in the Arrowhead region on August 20th. And you can find those on our website or on our Facebook page. And feel free to always email myself or Brenda or Georgia if you have any questions. Like she said, if we can help brainstorm, that is what we're here for. So I just want to thank you all for attending today. And I hope you have a great rest of your day.